Hi, I'm Selena and I'm from Pain-Free Physiotherapy in Aligned Health. I'm here to talk to you about how we can help with whiplash injuries. If you recently had a car accident, has developed pain all around the body, especially in the neck and your upper back, and is trying to find a cure to resolve all the painful spots in your body, then you should keep watching this video. You may have a condition known as whiplash. Whiplash refers to a neck injury that can occur when the head moves backward and forward. It can be a result of a sport accident, physical abuse, and the most commonly, a rear-end car accident. Depends on the level of injury, different people will present with different symptoms. The Quebec Task Force classifies patients with whiplash based on their severity and signs into grade 0 to 4. Grade 0 is when there's no symptoms with the neck at all. Grade 1 is when the neck might feel a bit sore and stiff, but from our physical assessment, you can still present with a full range of motion. Grade 2 is when your neck feels uncomfortable, and in our physical assessment, we realize you have a decrease in the range with your neck movements. Grade 3 is the same as Grade 2, plus with some neurological signs, such as reduced in sensation and strength. Grade 4 is the most severe one. It is more commonly seen in hospital, where patients may present with dislocations and even fractures in their neck. Most people are classified as Grade 2. There are 3 subgroups in Grade 2. Subgroup A is when the patient has no psychological impairments. Subgroup B is when the patients present with a bit psychological impairments. Subgroup C is when the patients present with severe psychological impairments that we can call it a post-traumatic disorder. Your doctor may get you to get some sort of imaging, such as X-ray or ultrasound, and in most cases, they will then give you medications to relieve your pain. It might reduce your pain in the short term, however, it doesn't really address the root cause. Due to the large variety of symptoms and the level of injury, it is important that we do a thorough assessment on your condition. At Pain-Free Physio, we'll do a holistic assessment to find out your root cause. We'll do a head-to-toe examination to look for all the contributing factors. Generally, these are the steps that we'll go through. Step 1. Normalize your neurodynamics. In a normal condition, you should be able to straighten your arm in this position. Looking at how well you can do this movement is called the upper limb neurodynamic test. However, if your nerve becomes very sensitive from the whiplash, then you may not be able to straighten the arm freely. This test indicates your nerve has become overly sensitive from the accident. In this case, it is very important for us to address that nerve and normalize the sensitivity first. Otherwise, the treatment can actually flare up or aggravate the symptoms. Okay, and then step 2 is to identify the psychological issues. As mentioned, it is very common for people with whiplash to present with both biological and psychological impairments. We'll identify the main concern, for example, the excessive pain, the stress of needing to work, as well as any financial issues, so we can liaise and work with other professionals to help you. For example, doctors, social workers, your case manager, and lawyers. After that, we'll perform hands-on therapy targeting on the root cause. And we'll also teach you exercises to do at home, depends on your condition. For example, exercises to retrain your muscle, to improve your joint positioning, or to train your gaze stability, because there is a strong connection between our eye muscles and our neck muscles. As mentioned before, if we find out your nerve has become overly sensitive from the accident, we'll perform a technique to normalize your neurodynamics. Let me show you how. First of all, we'll perform the upper limb neurodynamic test to see if we can fully straighten your arm in a nerve tension position. If there is a reduced in range in a nerve tension position with the wrist bent backward, then in a less nerve tension position with the wrist in neutral, we will perform this lateral glide technique. We will start off with having a feel of the patient's neck to find the problematic segment. Once we've identified the level, we then can provide a glide from the level up to the head laterally. It is important that we are moving everything from the top of the head to the target vertebra as one unit. And the amplitude needs to be gentle because nerve can be highly sensitive. After that, we can then recheck the test again. If this technique helps, we can progress it by performing the technique in the patient's limited range. This technique can mobilize the nerve root interface and reduce the tone of the muscles around the segments, hence promoting a restoration of the full range of the arm in the nerve tension position. Whereas if we find that you're using a wrong muscle pattern to move your head around, we'll teach you a home exercise to retrain your deep neck muscles.
So you wanted to look at the deep neck flexion in this position. Often I get them to bend the knees, so that will reduce if there was any dural tension. This position will be more comfortable. And then you just get them to nod their chin as if they are nodding for a yes. Okay. If they can do it, that's my instruction. Okay. If they cannot do it, then I can use other cues. For example, if you look at the ceiling, so this line here, okay, and then I'd like you to look down with your eyes to look at the corner there. So by using the eye movement can facilitate the deep neck flexors. A common fault would be they nod down too hard, and then you can see the superficial muscle working, or they lift the head off the pillow, and again that muscle, superficial muscle, will be working. If they still struggle, then you just pattern them. You just manually guide them. Okay, so this is the movement we want you to perform. So you practice that movement until they get the idea.
So, if you develop pain around your neck and back after a car accident, feel free to talk to us, and we'll be happy to answer your questions and tell you what we can do to help.